Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Today on the show, the big focus is on vaccines and how they can help prevent deaths in the pandemic. Now, the 4-month data of the National Vaccination Drive, which was released by the Health Ministry, showed that COVID vaccines' effectiveness in preventing mortality after the first dose stood at 96.6%. This reaffirms that vaccines offer near total protection against serious disease and death. The real-time data of COVID vaccination between April 18th and August 15th showed that vaccine effectiveness in preventing deaths further enhanced after the second dose of the vaccine, and then it stands at a very, very impressive 97.5%. In fact, the findings have also said that most of the deaths that occurred during the terrible second wave of coronavirus, that most of the deaths were among the unvaccinated. Well, to talk more about this, we're now joined by Dr. Chandrakant Lahariya, epidemiologist and health systems specialist. Thank you so much for joining us. And some great news. You know, while we all knew that vaccines do help in preventing disease and death, however, with these findings, it shows just how much they help. And also, it's a little surprising, but even just one dose of the vaccine helps in preventing serious disease.
I think this is very assuring because we always knew that vaccines prevent from moderate to severe illness and mortality, but this data is really assuring. However, I would like to give a caveat that we cannot call this effectiveness of the vaccine because effectiveness is something very different and which need to be studied in a more scientific approach. What we need to remember that from the available data with the Government of India, Indian Council of Medical Research, this has been found that the number of infections or number of deaths were 97% less in the vaccinated group than those who were in the unvaccinated group. But that's not effectiveness. And I want to also highlight that we know two terms. One is efficacy and other is effectiveness. So right. Efficacy is the clinical trials. And what we need to remember that efficacy is always higher than the effectiveness. So this is simply the finding based upon the data, but we should not use effectiveness. Having said everything, we need to remember that vaccines do work. And this is another proof that those vaccines are working and they reduce mortality. And this data, most likely the difference between the first one dose and two doses, 96.6% with mortality reduction with one dose is apparently appearing because we know in India there is a limited data available. Some of the data is not always captured, and we are hearing that number of infections and deaths are far less officially reported than actually happened. So this is an artifact, and that's why it should not be considered effectiveness. Effectiveness is more conducted under the clinic, very well-designed epidemiological studies. So effectiveness would be relatively lower, but this is everything said and done. This is really assuring.
All right, really assuring. So, Doctor, are you saying that we shouldn't have this false sense of confidence with just one dose of the vaccine based on this? Is that what you're saying?
Yes, exactly. Because this is a database which has been used to make some inferences. Now, that inference is not effectiveness. Usually, what happens in such kind of database that individual who have received vaccination and they know that they are protected, so their reporting is less likely to be through such database. That's one. Second is that to develop or understand effectiveness, we need to have an entire universe. Universe means like entire population which has been vaccinated in a particular geographical area. Something what is being done by Public Health England, which they have a larger database. Everybody is tracked irrespective of the vaccination status. And on their basis, the effectiveness has been found relatively lower in most of the studies done by Public Health England. But in this case, it's only a database which has been interpreted. It might be incomplete. Some of the sections might not have reported, and it's not comparative. That's why we should not call it effectiveness.
All right. So this is inference from the data. Now, but doctor, with 58% of the adult population having received one dose of the vaccine and 18%, around 18% fully vaccinated, that still gives a sense of confidence. And given that two of our states, Himachal Pradesh earlier and today the health minister tweeted that Goa too has 100% given the first dose to 100% of the adult population.
I think this India has made a fairly good progress on vaccination of the population, and even with the 58% adult population receiving single dose is a very good achievement. Especially we know that there is an emerging scientific evidence that people who have been infected in the past and then received the single shot of vaccine provides a really good level of antibody. And considering India had a ferocious second wave of Delta variant which has affected a large proportion of population, even a single shot would provide reasonable protection. But I would also insist that even though people have received one shot, it provides good protection. They should go for second shot as and when their turn comes. Now coming to the two shots, some of the population, 18% of the adult population has received two shots. I think that's where India need to pay attention to increase both coverage with the single shot and also ensure that those who have received one shot do not delay it and receive the second shot on the time.
All right, we're also joined by Dr. Vivek Javali, Chairman and HOD Cardiovascular Sciences at Fortis Hospitals. Thank you, Doctor, for joining us. We were discussing with Dr. Lahariya about these findings that were released by the Health Ministry yesterday when they spoke about how effective or how much protection one dose of the vaccine gives and the second dose and how it's effective in preventing serious disease and death as well. And so this is good news, and also the fact that 58% of our population, adult population, has been vaccinated with one dose. Given that right now we're fearing a third wave, this is all very welcome and reassuring news. Dr. Vivek?
Yes, I can hear you.
Yes,
can you hear me?
Yes, go ahead. So your comments on this?
Yeah, comment is that primarily we must understand that we till today have truly no proper medications for COVID infection. The only two things in our hand are vaccine and the appropriate behavior. Vaccine, every passing day, we are only getting good news. There has been no bad news. Much of the bad news were fake. The good news is that there are some solid evidences now available of the phase 3 trials of the Pfizer BioNTech. Then there's a phase 3 trial also of the efficacy of Moderna. And then there are news coming from UK phase 3, South Africa phase 2B, and then so on and so forth. And our own ICMR that we all read in the newspapers today, that the news has been extremely good. And after the second dose, again, the dope of first dose being all right, good, is not correct because a lot of people may become little careless about the second dose. The second dose
Right.
and 7 days or at least 15 days after the second dose, I think we are very well protected, and we are very sure now that the death due to COVID can be certainly avoided by taking 2 doses of our own country-made vaccine. So the news is very good, and I think all of us must assuredly remember that the only weapon we have in our hand is vaccine, vaccine, vaccine.
Right. Dr. Lahariya, I want to ask you, what does this mean about for herd immunity? Because even though people are vaccinated, we now know that they still can carry the infection and spread the infection. So what does it mean, since we've been talking about herd immunity from the start of this pandemic?
So there was a lot of discussion in the beginning of the pandemic about herd immunity, and then initially it was being thought that 70% of population either developed immunity after natural infection or vaccination, we would have a control over pandemic. But now it is very clear that Delta variant being 60 to 70% more transmissible, that threshold of herd immunity would be either 85% or even higher. But what we need to remember that in the pandemic, it is unlikely to be achieved. There are 2 reasons. One, that people who have got natural infection might be protected, but immunity wanes off. Similarly, with the vaccination, immunity wanes off or antibody level disappear with the time of 9 months or even or
Right.
maybe a little long. So some people who received vaccination a little earlier, and then they would be again back in that cycle. So this will be a rolling immunity level achievement. So it's very unlikely that we can achieve herd immunity only through infection or in a shorter period of time. So the only solution is that the entire eligible population, be it adult population or as and when children are allowed to be vaccinated, should receive vaccine, and then only we will achieve that threshold. The final point is that we need to remember that we are currently saying threshold of 85 to 90%. Now currently only adult population is being vaccinated, which is 60% of the total population. So
Yes.
even if 100% of population is vaccinated, only 60% of total population will be fully protected. So that's why herd immunity is not applicable as of now for controlling this pandemic.
All right. And Dr. Vivek, if we can come back to the point about the push for the vaccine drive, and are we still seeing lots of vaccine hesitancy, especially in rural parts, because you keep hearing reports here and there?
Absolutely, both rural and urban. I think a lot of damage has been done by the naysayer and fake news spreaders. Even today in a city like Bangalore, which is so educated, so modern, so sophisticated, I see certain classes of the society so resistant. There are some people who are at the higher helm, cheering certain important public institutions, telling me, when I tell them that 1 crore people were vaccinated today, and the people say that this is all pampering of the pharma sector. This kind of talking by educated people, people at the helm of affairs, is not correct. And I think vaccine hesitancy, even till today, is a fact. And I think we must fight that.
No, absolutely. And that's what we're trying to do here, with these programs. Thank you so much, both doctors, for joining us on the show to talk about this very, very important point. Well, let's now focus on the United States, where vaccine hesitancy again is a very real problem. And with a resurgent COVID pandemic in the US driven by the Delta variant of the virus, President Joe Biden has said he'd ordered all executive branch employees, federal contractors, and millions of healthcare workers to be vaccinated against coronavirus, and that his administration will issue rules requiring large private employers to mandate shots or testing. Biden also delivered some of his harshest criticism yet of the 25% of US adults who've so far not been inoculated, saying that they're dragging out the pandemic. He said, "My message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see?" He said, "We've been patient, but our patience is running thin, and your refusal has cost all of us, so please do the right thing." So very, very strong words there from the US president. Well, to talk more about the situation in the United States, we're joined by Dr. Peter Chin Hong, infectious disease specialist from University of California. Thank you so much for joining us on the show again. Doctor, first and foremost, what is the COVID situation in the US now? Have the cases somewhat stabilized?
It's stabilizing, but at a very high level. We haven't come down the mountain yet. It's still at a very, very high level. So that means that we're in a very tenuous situation. There's a lot of circulating virus in many parts of the country. And even though the cases are going down, new cases per day, we're still at the highest levels since January, with a lot of deaths. So in terms of numbers, we're more than 150,000 cases a day and more than 1,500 deaths per day, which is, really staggering if you think about it.
Right. And Doctor, what we now know is that people who are vaccinated also carry the virus. So currently what you're seeing in the US, given, the mask mandates were removed, that the Delta variant is moving between the vaccinated and unvaccinated people?
Yes, exactly. It's kind of a perfect storm with a mix of unvaccinated, vaccinated, and a highly transmissible variant. And added to that, there are many parts in the country where additional risk mitigation factors like masking or testing isn't really embraced as much as in other parts of the country. So essentially what you see is two really different countries within one country.
And what is the US doing to tackle vaccine hesitancy? You've had President Biden taking it up very, very strongly.
Yes, so from the beginning of the vaccination program, there was a combination of carrots and sticks. So I think we've tried all the carrots. There have been lotteries and jackpots and, alcohol given if you got a shot. Last week in San Francisco, we can get a pint of ice cream if you show your vaccine card. But these carrots don't work for the vast majority of unvaccinated Americans. I think, therefore, we think about the sticks. So some of the sticks that we've been trying recently include restaurant mandates, but that's not widespread. In some parts of the country, you need to show your vaccination to get into the restaurant or the bar. But I think ultimately what will drive the needle a little bit more will be requirements for work, not just public work, but private sector as well. Requirements for schools. The military now has a vaccine mandate and the Pentagon. So I think this is setting the stage not just for local jurisdictions saying we think vaccines are needed in the workplace and in schools, but on a national level, and we need a national strategy in this way.
Right, Dr. Peter, now why are so many people in the US convinced about Ivermectin as a preventive medicine? It's become a huge controversy there. And having said that, even in India, some states initially gave it out for free, state governments, and even doctors used to recommend it in the early days of the pandemic.
Yes, so in the initial days, it was understandable why people were thinking about ivermectin in the same way they were thinking about hydroxychloroquine or, Kaletra and HIV medicines. In the laboratory, it looks like it works, but the levels of ivermectin, which is an antiparasitic drug that you'd need in the bloodstream, far exceeds the safety profile of the drug, meaning you can get into toxicity if you really try to kill COVID in the bloodstream. And in fact, the studies are not really high quality. They are very mixed, small sample size, more than 15 studies. Some show a benefit, some show no benefit. But regardless, it's become very, very politicized, just like hydroxychloroquine in the US in the early days, so that people are going to animal feed stores to buy ivermectin meant for horses or sheep. And, they're taking these very large doses and they're getting into problems and being admitted to the hospital.
And you're still dealing with the Delta variant, but now there are reports of the Mu variant, which has spread to several states. How concerning is this?
Yes, so the Mu variant is mainly pretty regional right now in Colombia. Initially about not detected then, 40%, now more than 90% spread to neighboring countries like Ecuador. And in the United States, we have every state reporting at least one Mu variant case, but it's still accounting for less than 0.02% of cases. And the Delta is still the bully in the United States. It's accounting for more than 99% of cases. We don't know much about Mu except that theoretically in the lab, it can have more vaccine resistance like the Beta variant in South Africa. It shares some of the same mutations. It's definitely something to watch. The WHO called it a variant of interest, not concern. And the CDC in the United States hasn't even called it a variant of interest yet.
Now, Dr. Peter, the WHO has asked that everyone hold off on booster shots till next year, considering this divide between, the poorer countries and the richer countries, how unfair it is. And the US is considering booster shots. So what currently is the stand on this?
Yeah, so I think the opinion in the United States is mixed. This is actually the first conflict scientifically in the Biden administration, with the Biden administration really pushing for September 20th rollout of a booster program. But the CDC and FDA and the scientists are really wanting to look more at the data, regardless of how you slice and dice the pie. The vast amount of hospitalizations are occurring in unvaccinated, more than 90%, 95% in some areas. And the deaths are predominantly in the unvaccinated, more than 99% in some cases. So I think there's no real urgency. You can be proactive maybe in the older population over 65, because at the end of the day, personally, I don't care if you show that antibodies wane in the bloodstream. As long as we protect against disease, serious disease, and straining our hospital system, we're going to be okay for the time being.
All right. Thank you so much for joining us on the program, Dr. Peter Chin Hong. They're joining us from the United States.